Oh, we got fireworks.
We have fireworks on the screen. What just happened? Hi. Fireworks.
Yeah.
Hi you guys, we are live both on YouTube and Instagram this morning. My sweet daughter is filming behind the scenes on the YouTube side. Ask us any questions as we go, but we are talking about the way that we treat back and forth chiro and PT.
Yeah. Okay, so will you talk about when you're treating SI joint, for example?
Yes.
I assume it's not different pregnant or not.
Good question. A little bit, because depending on the situation with the pregnant patient, I may or may not do side posture.
Oh, fair, yeah.
And I may or may not do a certain stretch.
Will you say what you're looking for, feeling for when you're treating that?
Yes, and then you will.
Yes.
Okay, cool.
Exactly.
We're gonna do like a this versus that, and then like, when do we say, nope, not for me anymore, I'm gonna send you to PT, and sometimes it's pelvic floor, and sometimes it's PT for like shoulder. So it is different.
Yeah.
So we'll dive into that a little bit, but
Yeah.
we're talking SI, you asked SI.
I did.
SI is your pelvis. So it is your sacroiliac joint, for those of you who don't know. So typically for somebody with SI, with an SI problem, they are coming in with low back pain is what they say, or hip pain is what they say, or they will say tailbone pain even. Those all indicate something with the SI joint. And on my side, on the chiropractic side, I'm Dr. Jessie, by the way, for those of you who don't know me, I am a chiropractor on that side of things, so I point because it's the other side of the office. And I am looking for more of the bony mobility side of things when I'm assessing for SI pain, or like where the pain is coming from specifically. And I'm also looking to see if a side of the pelvis is higher or lower. And that's both on the front and the back side of the pelvis. So for me, in like to simplify it, I'm looking at the alignment of the pelvis and or kind of the shift in the pelvis. I feel like is the best way to describe what I'm assessing. That is our phone. I'm not getting it. I'm not getting it. We're not treating. I'm sorry, I can't get it this moment. I'm sorry. Please leave a message. I will check it in 5 minutes. But in saying that, then with treatment, I'm looking to mobilize it, to create movement. Love movement. And when I'm moving things versus when Dr. Alyssa is moving things, and obviously she'll talk about it, but I'm looking for quicker movement. So chiropractic, the way that we do it in here is a high velocity, low amplitude. So we're looking at a quick movement, not super deep, but quick. And then you get that physiologic response, which typically lends itself to relief of pain or taking pressure off a nerve root or taking pressure off the actual joint itself. Because like for pregnant women, their pelvis shifts like this throughout pregnancy and then it starts to shift back like this. But sometimes what happens then is you get a pretty severe pinch on that backside. It's almost my job to unpinch, if I'm going to simplify it.
Mm-hmm.
Now from there, the little bit of soft tissue work that I do, if that is, and that means like some hip flexor stretching, some hamstring stretching, and some piriformis butt muscle stretching. If after that, they're like, still really bugging me, or they'll even say, well, it still feels like kind of heavy, or it still feels like deeper. That for me is my red flag, or not red flag, but that's my flag to be like, PT.
Okay.
Yeah?
Mm-hmm.
Okay, cool.
Yeah. And I'm Dr. Alyssa with Pelvic Floor For Moms on this side. And okay, so when I get SI joint pain patients in, whether pregnant or not pregnant, honestly, a lot of them I'm going to see the same outside of how we position the patient and those sorts of things. I am thinking, first I'm going to check posture, because like the way we stand and posture and things like that is going to affect like the load on that joint. So we're going to talk about that, do some tests to like help the patient see that, and that's often like homework for them. Like, okay, if you do only one thing, think about your posture during the day and like that core activation. And then I will check mobility and alignment. I've treated spine for lots of years, so like really I've just seen lots of spine over and over again, and so I end up looking at a lot of the same things Dr. Jessie looks at in terms of how does the pelvis look front and back. Also, I'll kind of like spring each side of the pelvis to see like, well, your pain is on the right side, but actually the left side feels more sticky, so we're gonna like treat that side a little bit more. And when I'm trying to create mobility in that, I'm going to do more of those like, not quick movements, but like more of a slow slide, take it to end range, but like kind of stretch there a little bit versus those like quick chiropractic sorts of movements, so different ways to get movement in the joint. And then I end up doing a lot more soft tissue work, and so all those muscles along the SI joint, in the low back, I'm gonna spend a lot more time on that stuff. And so I kind of think about like, I'm doing more of like getting the muscles to move better, and a little bit of the joints to move better, and like chiropractic is a lot more of like, I'm gonna do a lot to get the joints moving better, and like a little bit to get the muscles to move better. And then also like a mainstay of physical therapy is stability, right? So like I wanna check your strength and how well those muscles are firing, and like the right muscles firing at the right times. Are you using your glutes, or are you using your quads? Are you using like transverse abdominis deep core, or do you like use like way too much upper abdominals? And so making sure that we are firing the right muscles and also strong enough and using them at the right sorts of times. So you're gonna get homework on that.
I was going to add to the modalities, because that is something I refer to Dr. Alyssa for all the time. And I mean, I did obviously before she was even in this clinic, but the dry needling and the cupping, those two particular tools are often things people haven't tried for soft tissue, and man, are they effective. And I am a really big fan of things that are effective, because A, I don't have time, and B, I don't have time. So I have to constantly get the job done, and I feel like that's what a lot of our patients need as well, and I am a really big advocate of those modalities. And so that's also a thing, like SI joint wise, if it's, well, even if we get really great results on the chiropractic side, I always feel like there's, you know, more if you're still feeling something, or if something's still affecting you. So in addition to the stabilization and some of that slower moving mobility, she can also dry needle and cup, which I don't do on my side. And so that is also an amazing tool for pain relief.
And that's honestly, it gets the job done way faster.
It does.
Like it just is the
if you haven't tried it, you gotta try it, because it's amazing. It's not like so relaxing, but it's effective.
Well, and we've been doing it second and third trimester of pregnancy too. So like, pregnancy safe in like the appropriate places and whatever. But so dry needling. And so from my perspective, when I send to chiropractic, whether they see me first or, you know, I've been seeing them for PT, they've already been to chiro, but like, well, I feel like I've exhausted my PT route. If there's a joint that I feel is like really sticky still and I just can't get to move, it's like, I feel like someone just needs to really knock that loose. Then I'm gonna
knock that loose.
Knock it loose.
That's me.
Send it back to chiro. Honestly, ribs, I'm not great at. I will do that mobilization, but sometimes I just need to, again, have that like quick adjustment, so I'll send them back for that.
Love ribs.
Love ribs, there you go. I had another thought.
Well, we'll do another live.
Oh, but I was gonna say, but I think it's nice to have the patient do both sometimes, and then they get to decide, because like they know what their resources are.
Yeah.
And so once their pain is better, and maybe it, you know, flares up in 6 months, or just like as they're going through their course of care to get this one, you know, episode better, they can self-elect of like, this feels like it's helping right now, or this feels, or like if I go every other, or whatever.
Well, we were just talking about this. We have a patient who just recently had a flare-up, and she ended up seeing both of us basically at the same time to get rid of this acute flare-up of pain, and it is so much more effective when you can do that alongside each other. The effects are just so much more effective and speedy. Yeah. Things get better faster. And so that we were truly just talking about this, just happenstance, and it's really effective to use both sides of things. So
I do feel I feel like it gets people better faster.
Yeah.
And what I've been seeing when I dry needle people in this setting with, you know, they've been to chiro already, they already get better faster. I end up needling them like 2 or 3 times once a week, and then I don't see them anymore, or even just needle them once and I don't see them anymore, because they're already healthy people. They're like exercising, generally speaking, and they're getting the chiropractic care, so like all that stuff neurologically and joint mobility wise is moving well, and so we can just like needle it once or twice and they're on their way. So it's cool.
On your way.
Yeah.
It's fun though.
Yeah.
It is fun.
Yeah.
Okay, questions, always send them to us. Let us know. Enjoy your weekend ahead. Happy Friday. We'll see you later.
How do you stop it?
Oh.